We're back, and I'm back with Dr. Farrell, and we're going to talk about eating disorders. So you are our addiction specialist, but you also deal a lot with eating disorders.
Yes, I deal with chemical addictions, but also behavioral addictions, sex, gambling, video games,
I like that.
and eating disorders.
I love that. So this is pervasive in our society, and I know, people tend to relate it to women. I know it's not just a female disorder.
I have plenty of male patients.
But it does seem like we've got, I noticed because I have a 14-year-old daughter, and I see her friends, and it's non-stop, the talk about being thin, about their bodies, about not liking their bodies. And one day they came over to my house, and they had saw on Instagram, some tea that's supposed to be good for you, and it was a detox tea. It was labeled detox tea, and they came over and they were making tea, and I came downstairs and I happened to see it. Now I tend to know these code words, and I picked it up and I'm like, it was a laxative tea. Now they didn't actually even know that, but I'm just saying it's so pervasive, it's actually scary. And it starts so young, and some of these girls don't even realize it, and they're like on this slippery slope before they even know it. And when I told Chloe that, she actually freaked out because she just didn't know. She was like so freaked out and so scared. But I saw even early on like her discomfort starting with her body. And it's just I hated my body when I was young.
Oh my goodness. I think you hate your body until you hit 40 and then finally
right, and I don't care. Right. That's exactly what happened. I hated my body. I used to just beat myself up, and then I just remember I went through a lot of therapy, and I remember just finally one day going, I actually don't care what you think about me. I don't know what happened, if it's hormonal or if it's finally just enough therapy. I'm not exactly sure. But
yeah, age is magical for women.
Yeah, it's wonderful. I wouldn't go back to save my life.
No.
There's no way.
Not unless I could bring my brain with me to my 20s, and then I would do
just
it all
so that I
day
could
long.
do it so cool. It'd be so cool.
Exactly, we'd rule the world.
Right?
Yes. But kids, younger teenagers and people in their 20s, it's so peer driven, and there's this comparison. And so that drives a lot of the body image issues. Now that's different than when we get into actual eating disorders, because it goes beyond even that. Here in California, it's a lot worse than in some other places. We just have
Florida's like that. I think.
Yeah, I don't know if it's because we're in bathing suits all year long,
so.
or right by LA. So I think it's a lot worse in California than it is in other places. So there's this normal aging and body image stuff that we all have to work through as young women, and a lot of men work through that too for various reasons. But that's different than actually developing an eating disorder. So there's a lot of differences. There are a lot of different kinds of eating disorders. There are some that are characterized by restricting food intake. There are some that are characterized by just overeating and just diving into food and binging. And then there are some that people will binge, and then they feel guilty, and then they'll purge. They'll use laxatives, they'll use exercise, or induce vomiting.
I did that horribly when I was young.
So there's a lot of different ways of people trying to regulate. So I
didn't even know. I have to just stop you for 1 second. I didn't know exercise bulimia was a thing until I went to the doctor one day, and I had the flu, and I had gone to the gym. I literally had a fever, and I'd gone to the gym. And he was like, "What are you doing?" I'm like, "I'm trying to sweat it out." And he was like, "And how often do you do that?" And I'm like, "Well, if I'm stressed, I go to the gym. If I'm sick, I go to the gym." He's like, "You have bulimia." And I was like, "No, I don't." I was so horrified. But I had all of the characteristics. That was my control mechanism, was to go sweat it out. And I hated my body, and I had all those same issues. It was a control thing. Is that a common thing?
It is. It is. And so it's hard to talk about eating disorders as one category, because there are so many different types. And, so lumping in anorexia with binge purging, with overeating, it's difficult to have one generalized conversation.
So we can have our own version.
Yes. Control is a big issue. And for a lot of people, the way that they grow up, there's books written on family dynamics of eating disorders. For some people, food becomes the only way they can control. And so they regulate themselves through regulation of food, because they've never been allowed to control anything else in their lives before. And for other people, overindulging in food is somehow emotionally protective. I don't know if you've ever seen this show on cable called My 600 Pound Life. And it's kind of like a documentary where they follow people who are morbidly obese and weigh, 500-600 pounds plus. And they go through their various treatments when they seek help from a weight loss specialist. And they talk about the diet and nutrition and exercise. But when you watch, my compassion just overflows, because most of these people who are on there have had some really deep emotional things happen to them. And they describe food as their coping strategy. And so if you don't address that and you only say, well, you have to diet and exercise, then they're not going to be able to do that, because it's not a lack of...
It's not that simple.
Yeah, it's not really a lack of self-control. It's really they're trying to soothe this deep
It's like drugs or
anxiety
alcohol.
and fear. Exactly.
Yeah. Interesting. That's so interesting. I know anorexia, I've always heard, is one of the most devastating. I know it kills a lot of young people in our society. Isn't it like the second leading cause of death of teenage girls or something like that?
I'm not fabulous about statistics because it bores me, but it's up there.
Right.
And there's a lot of dangers with withholding, and a lot of people who are severely underweight will also purge. So we don't classify an eating disorder based on the behavior. We classify it based on weight. So someone with anorexia is below a certain percentage of a healthy body weight, regardless of whether there's binging, purging behaviors. And so we can see with these young women, so not only are they not getting their nutrients, but if there's purging behaviors, then you can have electrolyte imbalances.
Right.
You can lose a lot of potassium, and that's where you can have young people having heart attacks.
Right.
And
go to
strokes
cardiac arrest.
Absolutely. So it is very dangerous.
Yeah, it's really scary. Yeah, I see this obsession that kids have with being perfect, and that scares me. It actually scares me. And like you said, there comes an age, I'm not sure if it's probably always been that way to some degree. I think it's worse in our society, and especially in an internet society. It's pretty scary.
I would have died if I had Facebook when I was a teenager.
Right?
Like I couldn't have handled that.
Right. It's terrible.
Yeah.
And I see the pictures of the young girls in 7th grade on Instagram and what they're putting out there, and it's like, wow, the pressure is insane. These girls look like they're 16. And it's just crazy what they put themselves through to look like that, and to put these pictures out there. I don't know what to tell parents to help their young girls, or kids in general. What advice would you have to families to help them be grounded and not be susceptible to that, or is there?
It's a complicated question because I see all sorts of patients with all sorts of different backgrounds that come in different family dynamics. Certainly when there's kind of a family dynamic of shame around food, then that sets people up for secretive eating or trying to hide. And so, you want to start with communication. If you think there's a problem, talking to your kids about it, and what do you think about this, and what do you think about what's going on with your friends at school, and just having conversations. I treat mostly adults. I don't treat young kids, so it's hard for me to kind of jump into what you would say to an 8-year-old. And so with the adults that I meet, these patterns are long-standing patterns, and we have to go back and figure out, well, where did this come from? So there's kind of two approaches when I'm treating. It's like, well, okay, we have to treat the thing. We have to look at, well, what do we actually do to treat? We need to have the right nutrition. We need to kind of go through
Yeah, I'm amazed at how often they don't really understand nutrition. Like it's gotten so mixed up in their heads.
Well, nutrition, we always say at the Amen clinics, food can be your best medicine.
Or your worst enemy.
Yeah, well, because they see food, they see even healthy food as your worst enemy.
Right.
So when we say that food can be your worst enemy, well, yes, if you're eating,
toxic,
curly fries and, fast foods.
But
and
they
all
see
these
all
things,
food as the enemy.
Yeah, potentially, yes. I have a good friend who has struggled with anorexia the whole time I've known her. And she had such horrible anxiety, and she called me one day and said, I'm thinking about going on medication. My doctor said this medication, I'm crawling out of my skin. I've been doing therapy. What do you think? And I said, well, this is the right category of medication for you. I think that it could be helpful. What are your goals with it? We just kind of talked through it. And she called me up. She was doing really well with it. And then another conversation several weeks later, she told me she stopped it. And I said, well, I'm curious why you decided, did you have side effects? And she said, no, actually it was working great. My anxiety went away and I stopped worrying about everything I was eating. I stopped worrying about the food and counting calories. I just felt relaxed and normal and I couldn't stand it.
She's not used to normal.
Yes, I learned a very important lesson from one of my patients several years ago. Changed the way I practice medicine. She had a panic disorder and panic attacks. And I treated her. We got rid of the panic attacks. And she called me one day from school and she said, I haven't had any panic attacks. And she said, Dr. Farrell, I miss them.
Oh my gosh.
I almost fell out of my chair. I just kind of took a deep breath and I said, oh, and I tried to sound all dignified and not surprised, tell me what you mean. And inside I'm going, what? And she said, panic attacks are horrible. You have them every day. And she said I'd have them. And then afterward, I'd be so relieved it was over. I could get something done with my day. She said, but now I don't have that. And I just feel weird. And I realized
it had become her normal.
It became her normal. And as much as our brains want change, we are creatures of habit and we resist
the brain
change.
hates change.
It does. And so when we're looking at whether we're talking about an addiction or we're talking about an eating disorder or something, I have to take that into consideration. I'm actually really grateful that I had this conversation with her, that I stopped and listened.
That's a really good point.
Because I talked to all my patients about it. As we're going along, logically you want to change. Emotionally, your brain is going to fight that. And so when you start resisting this, we need to have a conversation of, what are our goals? Are we reaching our goals? Are you fighting the goal, or are you really having a side effect? Are you really uncomfortable, or are we hitting a home run and you're emotionally not ready to hit that home run?
You made one other point, and I just want to touch on it really quickly before we sort of wrap up, is you see adults for eating disorders. And I think most people think of eating disorders as a childhood or adolescent disorder. Women have so much shame around eating disorders that they don't reach out for help.
So do men.
Oh, I would think men would be worse.
Yes,
I think men would be worse.
Because they see it as
a female
problem.
And a weakness. Mm-hmm. And I know so many women, because they reach out to me on Facebook. So I always encourage everybody, keep sending me your Facebook messages, but it's outside of my scope of practice. It's not because I don't love you. If I pass you on to someone like Dr. Farrell, or I have the call center call you, it's because it's irresponsible for anybody to answer your questions on Facebook, especially if they are a nurse or a coach. So I always have people send me their questions, but then I try to get them the appropriate help. And it scares me that people are just giving willy-nilly advice on Facebook.
Yeah. It is never too late to hit the reset button in life.
Right.
And so it doesn't matter how long someone's had an addiction, how long someone's had an eating disorder, how long someone's been in a toxic relationship or had a pattern of those things. We can always go in. We need to set some goals and figure out what are the steps we're going to take to start reaching toward these goals.
Absolutely. And it's amazing, and I've heard so many people describe this, and I remember with my own issues going through therapy, it's like, this is a really gross analogy, it's like popping a boil. It's like terrible, terrible, terrible till you go in and you actually do it, and then you're like, oh, it's like relief, right? Am I wrong on that?
Right, that is a really awful analogy.
It's awful, right? But it's true.
Yeah, and the fear is often
worse.
It can be worse, and there is a relief in doing it. But I'd say the relief kind of comes with time.
Yeah.
Because it's, again, that fear of the change.
It's probably different for everybody
fear
too,
of getting better.
Yeah.
But once you name it, there's something of just bringing it out of the darkness and having a partner and walking through that with you that can be really life-changing.
I love that. So this is Dr. Farrell. If you know someone or you are struggling, Dr. Farrell works in our Costa Mesa clinic. You can either call our call center, or you can leave me a message below. Please leave it in my private mailbox if you're going to leave your contact information. So if you want to leave your contact information in my private mailbox, we will have someone call you back. Thank you so much.